Good day, ma'am. I am Dorabel Calapili from BSN 212F, Group 23. And I will be performing immediate newborn care. So, immediate newborn care is a procedure that ensures the well-being of the baby and stabilizing the breathing of the baby, also to regulate the body temperature, and also it reduces the risk of infections and complications. It also supports a healthy start to life. So first is I will be washing my hands and prepare the needed materials. So hand washing deters the spread of microorganisms. So after hand washing, I will now be identifying the infant through a name brand or a name tag. It is to verify the baby's identity and also to avoid mix up and also to ensure that the infant is safe. So after that is I will now be enhancing the infant's comfort by turning on a drop light. It also provides warmth to the infant. Next is I will be placing on a linen on the weighing scale. And next is I will be washing my hands before putting on the working gloves. It is for infection control. So assuming that I already did a hand washing, I will now be wearing the working gloves. Next is I will now be weighing the newborn correctly. For for the normal ranges of the infant's weight, it ranges usually from 2.5 kilogram to 3.7 kilogram. So after this is I will now be placing the baby on the prepared materials. Next is I will now be applying the CRIDS prophylaxis on the patient's eye. First is I will be shading the light away from the eyes of the baby. It is to minimize discomfort and also to prevent serious eye infection. So first is what I will be doing when applying the CRIDS prophylaxis. I will be gently opening the eye of the patient or the baby, exerting a gentle force in the lower and the upper lid of the eye. So for the application of the ophthalmic ointment is I will be applying it from the inner canthus to the outer canthus of the eye of the infant's eyes. It is to, and we have to make sure that we avoided, or we have to careful not to touch the infant's eyes, and also it is to safeguard the newborn's delicate eye tissues. After that is I will now be injecting the vitamin K injection, which is I have to withdraw, or I will withdraw a 0.1 ml from the ampule, and I will be injecting it to the middle third lateral aspect of the infant's left thigh. So next is after I injected the patient with the vitamin K, we're gonna proceed now to inject the Hep B vaccine. We have to withdraw a 0.5 ml from the ampule also, and we're gonna inject it to the patient's right middle lateral aspect of the infant's right thigh. So this is for maintaining the consistent vaccine efficacy and reduces the discomfort of the baby. So after the Hep B vaccine, is I will now be carefully get the the measurement using the anthropometric measurement of the starting with the newborn from the head circumference, the chest, and also the abdomen. And also the newborn's length. It is to monitor the baby's growth and identify potential health issues early. So after that is I will now be taking the newborn's temperature rectally, and I will be inserting a temperature of the infant's anus, and also to check for the initial core body temperature. So after that is I will now be putting on the newborn's diaper, the shirt, the mittens, and the booties. It is to help the baby feel warm and comfortable, and also for the baby to feel protected. So after that is I will now be wrapping the newborn with a newborn securely with a clean blanket. It is to provide comfort and a sense of security, and also we are gonna mimic the warmth inside the mommy's or the infant's mommy's womb. After this is we'll now be placing the newborn into the crib with the drop light and drop light on, and we will be attaching the newborn or the crib tag. So it is to the use of the drop light is to ensure that the baby is visible. Also, we are gonna avoid accidents, and the while the crib tag is to identify the baby's information and also the name and the medical details. So next is I will now be taking the newborn's vital signs, which is the respiratory rate and the heart rate. So assuming that 1 minute has already passed, I will now proceed to check the infant's heart rate or pulse rate using a stethoscope placed on the infant's chest. So assuming that 1 minute has already passed, is I will now be doing the aftercare to maintain the hygiene area, and also it prevent infections, and also to promote the environment to be healthy and clean. And lastly, I will be taking off my gloves and do a hand hygiene. So the next step is to record the procedure done and also the other pertinent data. So first is that for the start or single dose or pre-op medication, I have given the infant named, the patient's name is Young Saxon. I have given him the vitamin K, which is through IM, also Hepa B through IM. So the next part is to check for the baby's vital sign sheet. So for the baby's pulse rate, it is 130 beats per minute. The respiratory rate is 40 breaths per minute, and also for the temperature is 36.7 degrees Celsius. For the baby's circumference, starting from the head is 33 centimeters. Also for the chest is 31, and the abdomen is 32 centimeters. For the height of the baby, it is 47 centimeters, and that's it, ma'am. For the documentation or the recording of the procedure done, the next step is to answer related questions of the procedure. So in this part, I will be addressing any I will be answering any concerns from the parents to ensure that the procedure is all cared of properly and to safeguard the newborn's health and well-being. And that's it for ma'am. Thank you.